Welcome back to the Healing Motherhood Podcast. Thank you so much for being here. In this episode, we are diving deeply into the first theme of Dr. Cheryl Beck's 4 Themes of Birth Trauma. The theme we're diving into today is to care for me. Was that too much to ask? So when we are talking about this theme, we are talking about this essence of feeling like your doctor doesn't care about you, right? Like maybe you're just a number, which if that's you, I'm so sorry. I can totally relate to that in my first experience. It can also refer to maybe feeling neglected by nurses or doctors during the birthing experience, during the prenatal experience, or even in the early postpartum time. So what happens when a mother feels overlooked, dismissed, dehumanized, or generally neglected during birth? That starts her off feeling like her needs don't matter. It starts her off feeling unimportant. So obviously this can have a huge impact on how a woman feels about her birth. It can absolutely create this traumatic memory about certain parts of her birth experience, right? A good example of this is if you're not getting the help that you need to use the restroom postpartum, right? That is something that can feel dehumanizing. It creates this extra contributor with a loss of dignity that ties into one of our other themes, right? So it can create this lasting impact from the anger, the sadness, the powerlessness, right? Of this already possibly difficult experience, and then not having your literal basic needs met is a big deal, right? Not being able to meet them, right? If you've had an epidural or an extensive surgery in order to save your life or your baby's life, that creates this situation where we're already even more vulnerable than we already are in birth. Birth is already this vulnerable time for many people. So with that, we already know, like if you're here, you know that compassionate care matters, right? You know that being empathetic to your clients, to your patients matters. Showing up for them matters. Treating them like a human matters. So let's talk a little bit about what we can do about it if you're preparing to birth again, but also what you can do about it even now is to start to think about who you are surrounding yourself with. Who is it that you are trusting with your medical care, with your home care, with your emotional needs, right? Do you feel safe with your medical provider? Do you feel safe with your midwife? Do you feel safe with your doula? Do you feel safe with if you have somebody helping you clean your house, if you have somebody preparing your meals? And how can you start to communicate your needs to your healthcare providers or your loved ones in order to get your needs met, basically? And then if that doesn't seem like something you're willing to do, I had this conversation with a client the other day and I said, okay, so did you, talk to your provider about what was going on, or did you totally ghost them? And I wasn't asking that to shame them. Like ghosting has this element of guilt and shame that it doesn't need to have. I think that when we are ghosting a medical provider, it's because they're not a good fit. And if we don't feel safe to have that conversation, you're paying them. Like there's nothing wrong with just choosing not to go back to a provider at all. That is something that you have a right to do. You have a right to choose who you want to pay to support you. So anytime that you are paying someone to support you. You do not owe them an explanation, and ghosting them is okay. I think that it's important to point out that you don't owe them anything. If you do not feel like that's a conversation that you can have, you don't have to advocate to have your needs met. You can just change providers. And that's with any provider, your therapist, your doctor, anybody, your doula, so your coach, anything like that. You have options, and you get to choose to be supported by somebody who is capable of providing compassionate care, is capable of showing you empathy. And then if that person is a family member, I actually have a guide that I will send you, a communication guide that can be used with loved ones for whatever it is you're going through. If you just fill out the link below. So to kind of wrap this one up, so thank you so much for being here. Check out the tools below, and I hope you'll hit subscribe so that we can dive into theme 2 tomorrow.